Okay. Okay.
Okay. We'll give people a few minutes to join.
Yes. Okay.
We'll just give people another minute here to join. Still a little bit early. Okay, I think we're ready. Are you ready, Rafa?
Already.
Great.
Already.
Hi, everybody. I am Stephanie Lloyd. I'm part of the marketing department for McKee-Pownall. And obviously today joins me Dr. Rafael Gomez, our breeding fanatic specialist. So this is now our second episode for our breeding webinar series. We have 3 more to come. So this is number 2. You can follow us on social media to look out for when those other episodes are coming out. And these are being recorded, so don't worry if you have to leave early or you miss anything. You'll be able to find them on our YouTube channel. So just subscribe and you'll find them there. There will be question and answers at the end. There's a box down below. So just pop in your questions there and Dr. Gomez will answer those at the end for you. And so, yeah. Let's begin. Dr. Gomez, over to you.
Thanks, Steph. Hello, everyone. Thank you very much for joining us again for another Repro night. I'm very excited to present to you again another topic now. This second webinar is going to be about breeding the problem mare. So continuing with the series, the first talk we had was about the estrus cycle, and it's important that we know the basics on how our mares behave, so we can understand how we're going to manage them, especially if we are dealing with a problematic mare. So let's get started. First, I just wanted to do a reminder on the last talk that we have, just so we remember a little bit how our mares behave. They are seasonal, meaning that they only cycle during one part of the year, that is long days, spring and summer. Polyestrus, they have multiple cycles during this season. They are monovulatory. Usually they only ovulate once, but there's like 7 to 25% percentage of mares that they ovulate double. They reach puberty when they are 12 to 18 months old. Remember that puberty is not the same as sexual maturity, but that's on the other talk. Estrous cycle length is more or less 21 days, plus minus 1.4, and the estrus behavior lasts from 5 to 7 days. We need to remember that during estrus, our mares are producing estrogens, which is the hormone that gives us the heat behavior on them. And when they're not in estrus, they're in diestrus, that they're producing progesterone. That is the hormone that helps the mare get through the pregnancy. So a little bit on the anatomy again, because it's back to the basics, but this is everything. So going from the outside to the inside, first we're gonna have the vulva. After the vulva, I don't know if you guys saw the Repro Thursdays clip, but we have our three main barriers that helps the mare stay away from the evil pathogens. So first we will have the vulva, that it's what we see in the outside. Then we have the vestibulum, that it's a fold that communicates the vulva with the vagina. Then we have the vagina, that it's just a cavity. Then we're gonna have the cervix. That's our third barrier. So the first one is the vulva, second one is the vestibulum, and the third one is the cervix. It's important that we remember these, and we're gonna talk about these three barriers a little bit after this reminder. But yeah, after the cervix, we have the uterus. We know that the mares have two horns, the uterine horns, left and right. After the uterine horns, we have the oviduct, very important structure because that's where fertilization is going to take place in. And then we have our ovaries. So the problem mare. What is the problem mare? And here we're going to be talking obviously specifically about the repro problem mare. Not all the mares that are cranky and a lot of times chestnut. So this is how like the definitions that I found in different books, that the problem mare is a mare that is not pregnant after being bred to a fertile stallion over 3 estrus cycles. I like this definition, and I think it's important that we notice that they say fertile stallion, because a lot of times we focus a lot on the mares and we blame everything on the mares, and it's like, no, my mare is not catching and there's something wrong with her, and we start doing all kinds of diagnosis, and we never look to the other side and we see like, hey, there's another part that is taking part in this breeding, and that's the stallion. So we need to make sure that our stallion, or the stallion that we're breeding the mare, is fertile. Nowadays, with the shipments of semen or frozen semen, it's easier to know that that stallion is fertile, but still we have to make sure that they are fertile. It also can be defined as a mare that cannot successfully carry a foal to term, a mare that with known reproductive pathology, a mare with behavioral issues related to reproduction. So these are three other kind of vague definitions, but between all of them, we kind of make one good definition of what a problem mare is, and you guys can know if you have a problem mare. So I wanted to share these. This is just like to differentiate what's subfertility versus infertility, even though in the literature we find the terminology infertility used a lot and very common. I think that the most accurate term would be subfertility, that it's any form of reduced fertility with prolonged time of unwanted conception. So mares that have been a long period of time not being able to get pregnant, but that they don't have an actual diagnosis that they cannot get pregnant. So infertility is not being able to get pregnant. This comes from the roots. Fertility comes from fertilis, I think it's Latin. That means bearing, in abundance, fruitful, productive. And then the prefix is sub is close or under, and in it's not. So I like to just make the difference, even though that in the literature you can find infertility used as subfertility, but I like to make the differentiation. So what are the most common causes of subfertility in our mares? And the first one, big, scary one, endometritis. And we're going to talk a little bit more about endometritis. And this englobes a lot of things that can be going on with the mare, from systemic disease on the mare to specific reproductive problems. It could be non-infectious or infectious. In the non-infections, it could be anatomical, degenerative, systemic, traumatic, genetic, or one that is very, very important we have in mind is the post-mating induced endometritis or persistent mating inducing endometritis. The infectious, it's usually bacterial or fungus that is going to be giving us problems. So what is endometritis? And to know what is the endometritis, because the definition is basically the inflammation of the endometrium. But what the hell is the endometrium? So the endometrium, it's the outer layer of the uterine lining of our uterine wall. So here we can see this is a cut, a little piece of uterus, where we're going to have the endometrium, that is the outside part of that uterus. Then we have the myometrium, that's the muscles that are going to contract, and that they are going to help us a lot in moving the spermatozoids, helping the spermatozoids go towards the oocyte, and also to clearing that uterus from semen, pathogens, fluid that the mare may have there. And the endometritis, when does that happen? When there's a failure to remove bacteria, spermatozoids, and there's inflammatory exudate in the uterus. One of the most common things that we're going to find in the non-infectious endometritis is going to be due to anatomical malfunctions. So what are the most classic ones? A classic one in thoroughbreds is going to be the perineal conformation, and it's not just thoroughbreds, but it's classic on that breed. But also older mares, thin mares, you're gonna see that they have this type of angle, where we have here the anus and the vulva. It's a little bit, they have an angle, like a bigger angle. So when this mare is going to defecate, all the feces come down here. And if this mare doesn't have a good vulvar close, if she has failure of one of those barriers that help her defend from pathogens, she's gonna get infected. She's gonna get all those bacteria that come in the feces, and they're gonna crawl and they're gonna go and infect our uterus. We also have cervical malfunctions, and this is a very important one, sometimes overlooked, but it is very important, especially in older maiden mares that have never had a foal and they have cervical malfunction. And what does this mean? That these mares, when they're in estrus and the cervix, it's supposed to be like this, relaxed, open, like everything can go through it. They're gonna have a cervix close to this one. The cervix is gonna be tight, it's not gonna be relaxed, and it's not gonna help the mare clear the fluid and clear those spermatozoids that need to come out of the uterus. We also have adhesions and trauma. They kind of come together, and trauma, it could be a kick or it could be postpartum, like this mare that we have here. This was post-foaling. She had a little bit of a bigger foal, and you can end with problems like this. But the way this vulva look, you can also see tears in the cervix. So when you're damaging the cervix, that's basically the door that keeps pathogens away from the uterus, and that's our last protective barrier. You can also have malfunction of the vulvar lips, that they don't close as tight as they should, and same with the vestibular fold. The vestibular fold should always be close together and in an angle, like cranioventral angle, going up. And there are some mares, older mares, it's usually the older mares, that this fold is just loose and it allows the pass of pathogens. Then we have one very important topic that I wanted to discuss, that is the post-mating induced endometritis. And this is like a big name, but it's actually something normal in mares, that they are supposed to react to the semen. Semen is a foreign body in the uterus. The uterus is made to be clear and to don't have any substance. So when we have, say, a natural cover, or when we're inseminating the mares, the semen is going to get into the uterus. So the mare, with all these estrogens that she has, being in estrus, she has a lot of blood flow in that uterus. She has a lot of defense cells. The immune system is going to be there because they are preparing for that, exactly, to get a foreign body, to get the semen, and then to expel it. She doesn't need all that semen. Like a normal ejaculate on a horse, it could be anywhere from 25, 30 mLs to 70 mLs. They don't need all that. They just need just a little bit to be able to get pregnant. So mares normally are going to react to that semen. How are they going to react? They're going to start having contractions and trying to expel that semen out of the uterus. Most mares are able to do it, and they have to do it in between 24 to 36 hours post-breeding, natural or insemination, it doesn't matter. But they have to be able to clear that uterus from that fluid and don't have a reaction. There are some predisposing factors for mares to have persistent mating induced endometritis. And what this means is the mares that after 36 hours were not able to clear that semen, and that at that point in time, they're going to be reacting to it, creating fluid, creating inflammatory fluid, and those glands in the endometrium are just producing fluid, and getting that uterus dirty, or like we call it dirty. Predisposing factors: pendulous uterus. Mares that have had a lot of foals, older mares, the uterus just stays a little bit lower than it usually does in the abdominal cavity. And it's harder for it to expel that semen. Cervix fail. Again, if our mare has a tight cervix, you're not going to be able, the uterus is not going to be able to empty that fluid. We're going to have also infectious agents that will promote these, of course, or large endometrial cyst. And this is only like physical. The endometrial cyst is just blocking a part of that uterus, of the uterine lumen, and it's not allowing the uterus to expel that semen. So this is very important, and this is a very important topic to have in mind, because a lot of times we think that it's just like we got our mare covered, that's perfect, let's wait 21 days, without knowing if she's reacting to that semen, if she's having some post-mating induced endometritis. And it's something that we are able to treat, and that we have to be on top of it, just to help your mare have a better pregnancy rate, and to get her on the first try or even the second try. It's important to know the mares, because usually once a mare has had an episode like this in a season, say these, you're trying to breed your mare, she comes up with that, then you treat her and everything, she gets pregnant. Most likely for next year, for next breeding season, she's gonna do the same, most likely. So it's an important thing to have in mind, and to talk to your veterinarian about it. And then we have the infectious agents, and we have a lot of them, a lot of funny names. The most common ones are Streptococcus echi, subspecies zooepidemicus, E. coli, Klebsiella, Enterobacter, all these kind of infectious agents. How they get to the uterus is usually an ascendant route, meaning they come from the outside and they go to the uterus. So a lot of times, failure in those three barriers that help our mares: vulva, the vestibular fold, and the cervix. How can they get into? If we're doing natural cover and we're not washing the stallion's penis before the mount, that could do it too. If they had bad perineal conformation with the feces, they're gonna get infected. If they don't have good vulvar closure, they're gonna get infected. They're gonna sucking pathogens. So that's basically how they get there. And with these pathogens, most of them, what we're gonna find is that it's gonna be hard to treat them. We're gonna have to diagnose them. Sometimes the diagnosis could be easy, just with a culture, but sometimes it's gonna be a little bit harder, because when they go into the uterus, it's not like they expand and you can see all the microorganisms in the whole uterine lining, like the body and the horns. No, they like to form little colonies. And they, in these little colonies, it's just like little plates, where they stay there. And when they start reproducing, they start forming a biofilm. And this is something to be kind of worried about, yes. But now we know that bacteria form biofilms. I mean, we've known that for a long time. And we have treatments to attack this biofilm. And what is the biofilm? It's just an adhesive matrix that supports growth and maintenance of the bacteria in microcolonies. So bacteria are really, really smart. And instead of being just floating around in the uterus, exposed to the antibiotics and to your immune system, what they did, they come up with it's basically like a little house, that this little house protects them from your immune system, well, the mare's immune system, and from the antibiotics. So if we're treating a mare and she has the biofilm, our antibiotics are not going to do anything to these bacteria. And sometimes there are some times that we can also try to take a swab, and the culture can come up negative, but in fact is positive, because your mare still not being able to get pregnant, and you come into a process of trying to diagnose what's going on. At some point, they build these houses, and when they are replicating, when there's a lot of bacteria there, they just pop the house and go and move to another place to build another house, and that's how they start infecting everything. It's important to mention that these infections, they only occur in the endometrium lining. So because they don't go any deeper, these bacteria, they don't crawl any deeper. There are no systemic signs for it. And these bacteria, they don't go systemically, and it's very rare, almost never they cause any type of systemic problem, like endotoxemia or laminitis. They usually stay there locally in the uterus, but it's a problem when you're trying to breed your mare. So what now? We know some causes. We know the causes of a problem mare. We know we've been talking a little bit about endometritis, post-mating endometritis. What do we do now? So now here comes the fun plan, the fun part, and the diagnostic plan. This is where the vet comes and starts talking to you about the problem mare, and we need to come up. We need to do a full evaluation of your mare, and starting with the reproductive history of your mare, any previous reproductive problems or just the history, but also history on the mare, like on the health of your mare, and a thorough physical examination. It's not only about the uterus. It's not everything. It's not all about palpating the uterus and seeing the uterus on the ultrasound. That's very important, but it's also very important to know the systemic status and the health status of the mares. We are not going to be able to breed a mare that has a problem like these very advanced and bad laminitis. We need to check the perineal region too, because that we'll know if that mare is going to have problems and how we can manage them. Another part of the diagnostic plan would be a teasing behavior. And that's great. If you have it, that's a great piece of information. But unfortunately, in a lot of places, we don't have a teasing stallion. If you have it, it's great, because that gives us a lot of clues, because they could be a mare that everything points like uterus. She has a big follicle. The uterus has edema. You see the ultrasound is like, no, this mare is in heat. When you go, you tease her and she's not acting in heat. So you start thinking about the problems that she may have. Perineal conformation, as we talked before, is very, very important in the mares. And then we're gonna go to palpation per rectum. What are we gonna feel? What is your vet feeling when we're arm deep inside your mare? What are we feeling? Well, we're feeling the cervix. We're feeling the tone of the cervix. We're feeling the tone of the uterus. We're evaluating where it is, if it's a pendulous uterus or if it's not. We're evaluating the ovaries. We're touching the ovaries, see if there are any structures, follicles, or if the ovaries just feel like infant. I don't know if that's the word in English, but we call it like that. They are not mature enough. There are some mares that can have immature ovaries. So we're evaluating that when we're palpating your mare. After that, a great piece of information, it's going to be the ultrasonography. So we're going to go with the ultrasound, and same, we're going to evaluate the cervix. A lot of times the length of the cervix, then we're going to see the uterine body, we're going to see the horns, and we're going to see what's going on in the ovaries. And we can know, a lot of times we can know if there is a problem with the mare. We don't know what the problem is, but if we see an ultrasound like this, where we see the uterus, this is the uterus, and we see fluid, all this dark matter is fluid, and that's not good. We don't want to see that fluid inside a mare's uterus. So we know that there's a problem. We know that we have to do something. After that, we're going to do a vaginal speculum. This is basically to evaluate the cervix and all the vagina, all the walls. We're going to evaluate. You can tell a lot by doing just an speculum on a mare. There are some mares that have problems with urine, that they cannot empty all the urine, so they have some urine in the vagina, and that little that little amount of urine that stays in the vagina can crawl into the uterus and cause a lot of problem. You can see if a mare is sucking air, and air is also going to cause problems in the uterus. We're going to do a manual or digital evaluation of the cervix, and usually I do this along with the uterine culture and cytology, because I don't like to put a lot of things in the mare's reproductive tract, because it could be another cause of infection. But we're going to evaluate if there's any adhesions, if there's any scars, if there's any tears, and how open it is compared to the follicular activity and the stage of the estrus cycle that your mare is. So, as I said before, if your mare is an estrus, that cervix should be relaxed, loose, open. So after that, we come to three very, very important diagnostic tools that really, really help us with the problem mare. One is the culture and the cytology. We usually do it in the same, with the same thing. Like for the uterine culture, we use a swab, and for the cytology, we use a brush. And basically with the cytology, we're just looking for cells. A mare's uterus should never have inflammatory cells in the lining, in the endometrium. So if in the cytology we are seeing inflammatory cells, neutrophils, more than 2 per paraffil, your mare has a problem. Even if the culture comes back negative, because you can have that, your mare has a problem. And then with the culture, what we're going to do is we're going to look for bacteria. Usually we do it with a swab, where we go, we pass the cervix, we take a swab sample, and then send it to the lab. A lot of times it's very reliable, but with those mares that the cytology tells you that there is a problem and the culture is negative, we can do a small volume uterine lavage. And this is basically to cover the whole uterus now. We're not taking a sample just with the swab, where the swab touched. We're taking a sample from the whole uterus and then sending that to the lab, and that could help us. And then the last piece would be an endometrial biopsy. And what the biopsy is going to tell us is your mare's uterus healthy enough to carry a pregnancy to term? You can also culture from the biopsy, and that's very helpful too. And you can also see if there's neutrophil infiltrates or immune cells. But basically, what it's going to tell us is your mare able to carry a foal to full term? So for the biopsy, we graded it. We have 3 grades. that is actually 4. I know it's kind of crazy, but that's something that veterinarians do, because we have grade 1, grade 2A, grade 2B, and grade 3. Grade 1, your mare is healthy, and she has, like as any healthy mare, 80 to 90% success rate. The 2A and 2B, it's like a big gray zone. But if you have a mare into A, into B, the success rate might be between 50 to, they say 80, could be like 70% of success rate of getting that mare pregnant, and for her to carry that that foal to term. And if you have a grade 3, she's not gonna carry the foal to term. I mean, the percentage is less than 10%. So this is just telling us if your mare is able to carry a foal to full term. If your mare has a severe endometrial biopsy, that it's a grade 3, and you are like crying because you're never gonna get a foal, don't worry, there are things that we can do. There's embryo transfer. That just means that she cannot carry the foal, but she can get pregnant, and we can take that embryo and put it in another mare. So those are basically the diagnostic plans that we are gonna come up, and they depend and they change a lot, and it's sometimes frustrating with the problem mares, not gonna lie, but it's what we have to help us get those mares pregnant. So now we're gonna pass to the treatment, and we have just 2 big groups. We have intrauterine and systemic treatment, and this will depend on the case, and a lot with the problem mares, it's depending on the mare, it's depending on the case, it's depending on the pathogen. But we have these 2 routes that we can use. And the most common lines of treatments that we're gonna do is ecbolics, that they aid in uterine contractions. So everyone that has bred a mare, they for sure know oxytocin. Antibiotics based on the sensitivity that we get from the culture. Mucolytics, these are the ones that are going to help us break that biofilm. So yeah, bacteria are very smart and they make that little house, but we know how to break that little house most of the times. And those mucolytic agents are going to be used in conjunction with the antibiotics. And then we have to modulate the inflammatory response, and we can do that before breeding, during the breeding, or after breeding, because we don't want that endometrium getting angry and producing a lot of fluid, because we want the uterus to be as clean as possible for that embryo to come down, or for the semen to go in. So we have the oxytocin. We also have uterine lavages. They could be medicated or without medication, just pure saline. Is just to get that, to help your mares getting that fluid out, kind of like post-mating induced endometritis. What you can do for that, before your mare gets a reaction, you can post-insemination flush your mare 4 to 6 hours post-breeding. You flush your mare, you're taking out all the excessive semen that is there, and you're helping your mare getting rid of a foreign body that it's going to make her react. So the take-home message is, again, I think I said this before, but have good records, have records of your mares, know how they behave reproductively. If a mare is producing fluid, she's gonna do it next season. If she, I don't know, if she has cervical malfunction, or if she doesn't show heat or whatever, have good records. That's very important. Second one is individualized attention to each problem mare, and this is a very important part, because every mare is different. Every case is different, even though if it's the same bacteria or not, if it's the same sensitivity to the same antibiotic or not, every case is different. So every mare needs individualized attention. I've heard a lot of colleagues or other vets that they say that equine reproduction is kind of like following a cooking recipe, and I don't think it's like that. I think every mare has their own problems, and we have to be careful, and we have to be very focused on each mare. Then the diagnostics, that's gonna give us everything. That's the only way that we're gonna be able to help you. Your problem mare is our problem mare, because we take it as a personal challenge. Well, I do. I take it as a personal challenge, and for me, it's just like, it's just that it's a challenge. I want to get that mare pregnant, and diagnostics is what we can do to help us get to that goal. We have to be committed to success and be persistent. We need to be flexible to change diagnosis and or treatment course. That's something that it's frustrating, and it's frustrating for the owners, and it's frustrating for the vets. But sometimes we culture a mare and we get a E. coli. We come back, we treat everything. We come back, we reculture, and then the next culture has a different bacteria. And then we're treating for another bacteria. And then the mare didn't cycle correctly, or didn't ovulate, or whatever. It's a passion that we have to have, but we need to be flexible to change diagnosis and treatment. We need to be mindful of that. And we have to be realistic with the prognosis. If you have a mare with a bad biopsy and you're not willing to do embryo transfers, we have to be realistic, and we need to know when to quit, when it's been enough in trying. And yeah, that, I think that's it. That covers a little bit on the problem mare, all the aspects. I hope you guys liked the talk, and we're gonna move to the Q&A section. We have some questions here. Just wanted to mention, this is Victoria. This is my favorite mare from Mexico. I know her since she was a filly when I was in vet school, and I fell in love with her. And then I was able to ride her and have fun with her. So she likes to make funny faces. Okay, so we have some questions here. The first one, does AI circumvent endometritis? Oh, I'm sorry. My English is not the great, so I'm just gonna Google circumvent. Oh, like obstruction. No. AI, it's a great tool for us, because we can divide the semen doses, all the doses that a stallion has in one ejaculate. We can divide it, and we can get several mares pregnant, and we can modulate the volume, and that's going to depend on the extender and on the concentration of the spermatozoids that each dose has. It's usually 1 billion. It can reduce the effect on post-mating endometritis. It can, but honestly, if a mare is prone to reacting to that semen, or she has a cervical malfunction, it doesn't matter if it's natural cover, or it doesn't matter if it's AI with fresh or with frozen. They're gonna react. Even with frozen, that it's tiny amounts of volume, they are going to react to the foreign body. It's more a way of their uterus to say, there's something weird here, we have to get rid of it, and not knowing how, or not being able to expel that fluid. So it helps you with transmission of diseases, that's for sure. AI helps you with that. It's a safer way to do things, safer for the stallion, safer for the vet, both the vets and the personnel handling the stallion, safer for the mares too. And it's a way to officiate the stallions, like all the doses in the stallions. We have another question here. Is, what are some of the problems teasing can reveal, assuming everything else is on track to be bred? Teasing can let you know when a mare is having behavioral problems. Like if your mare is in heat, and everything looks well, and she has edema and everything, and she's not behaving like she should be, that's when teasing comes, when it's helpful, or when mares are coming into heat constantly. That should be like a red light that, hey, maybe there's something wrong, because when a mare has a uterine infection, sometimes they tend to come into heat more often and sooner than they usually do. That's one of the things that they can help you. The other thing that can help us is when we're trying to see if the mare is just in heat, just to help your vet know if she's starting in heat, and if that heat lasts more than it should, then you have a problem that with the simplest thing as teasing your mare, you will know that it's like, oh, you know what? There's something wrong with this mare. There's something weird. Here we have another one. If a mare has had foals successfully, but was open for 2 years, what would your first step be prior to breeding again? Well, the first step would be do a full reproductive evaluation, everything that we talked to in the diagnostics slide. Just check the health status of the mare, check the reproductive status of the mare, check that cervix is okay, that the uterus is not pendulous, probably 2 foals. It's not too much, depending on how many foals she's had. And then I would really consider culture and cytology the mare before breeding season. Once she starts showing signs of cycle and that cervix starts to open, getting a culture and cytology just to make sure that everything is it's okay in the uterus and you're good to go. That would be where I would start with a mare like that. There's another one here. What do you think about a mare who is pregnant at the 17-day check, but has reabsorbed the pregnancy by the 30-day check 3 times with the same stallion? Would you pursue a workup or try a different stallion? I would consider both. If it has been the 3 times with the same stallion, I would consider changing stallion. But first, I would dig a little bit deeper into what's wrong with the mare, if there's something wrong with the mare. Again, full reproductive workup on that, culture cytology, and just make sure that everything's okay. It's important to know the age of the mares. And this is a very important fact. Mares that are older than 13 years old, their uterus starts to degenerate slowly, but it starts to degenerate. There are some mares that do it quicker than other ones, but after 13 years old, I think it's also a good practice to have your mare, if you're thinking about breeding her or if she's not catching, to have a biopsy on the mare, just to make sure that she's still on a good grade to get pregnant and to carry a full term. And we're gonna go with the last one. Is there anything that can be done to get a mare to cycle normally when she has an anovulatory follicle, or is the season pretty much done when that happens? Anovulatory follicles are fun. Well, they're not. They suck. That's the truth. But you have to follow that mare. That's the thing with anovulatory follicles. You have to follow that mare. Once she has the first anovulatory follicle in the season, it's usually, let me go back. We can have anovulatory follicles at the beginning of the season and at the end of the reproductive season, and it could be normal. At the beginning, when they're trying to come out of that estrus phase and that winter estrus, and they're starting to just come into that transitional phase, they start growing follicles and then getting them shrink again, and they grow it. They can make an anovulatory here, and you just have to wait for them to make another follicle, pop it, have their first ovulation, and they start cycling. When it's at the end of the reproductive season, it might mean that your mare means that your mare it's coming into that transitional part of the year. So that the area on her brain, the GnRH pulses are starting to be lower, so she's starting to have less hormones, and it might mean that she's coming to an end of the season, but it doesn't mean that it's the actual end. Anovulatory follicles, that's where they usually come at the end and at the beginning, but they can come in the middle of the season, and they can have one anovulatory and then cycle 2-3 times again normally. Once you have diagnosed an anovulatory follicle, there's nothing we can do, unfortunately. And that's one of the worst enemies of us that we do repro. When you get an anovulatory follicle, it's very frustrating because there's nothing we can do. There's no hormones, there's no medication, there's no nothing. We just have to wait for that follicle to mature, to get to luteinize, form luteal cells, and then we can give some lutealize and get her started again. So to answer the question, it depends on when it was found. It not always means that your Mare is done, that that's it. But if you're seeing an anovulatory follicle around September, it's probably that your Mare is just going into transition, and it's gonna be more difficult for us to determine if the next cycle is gonna be a good one or if it's gonna be another anovulatory. Because that's the thing. When they are, when you're gonna have an anovulatory, you don't know if that follicle is going to ovulate or go to anovulatory. They just look exactly the same, and just a few hours apart from going to ovulation or to anovulatory. You can't tell until you go the next day and it's like, oh, it's an anovulatory, or my Mare just ovulated. If it's in the middle of the season, don't get disappointed. Your Mare can still cycle, and you can still get her pregnant. Okay.
Rafa, I think there's a few more questions that I saw. There's just one here. Is there something that can be done for a grade 3 mare if embryo transfer is not possible financially or otherwise?
Good question. The best thing to do would be embryo transfers. The other option would be aspirating the ovocytes, OPU, and then have them in, and do the ICSI, that is the intracytoplasmatic injection, where they just inject one spermatocyte on the oocyte. But that's a little bit, that's more expensive than the embryo transfer. If financially embryo transfers is not an option, your Mare most likely won't be able to carry a full to full term. So there's not much that we can do. Once that uterus has degenerated, it's mainly gone. There are some treatments that are a little harsh on the uterine lining, that it's basically infiltrating a substance that is caustic, and you're basically burning the entire endometrium of your Mare, all the lining, then flushing it out and then waiting for it to regenerate. And they say that it could change grades, but if you go from, it's very hard to go from a 3 to a 2, even 2B. So I would consider embryo transfer if it's an important Mare. I think it's worth it.
And just one last question. What if medically everything is on track to have a foal, but then she doesn't react to teasing?
That's a good that's a good question. There are some Mares that are, and this is like based on what I've seen sometimes with this type of Mares, it happens a lot with maiden Mares, young Mares, and dominant Mares that need a stallion to show them that the stallion is the dominant, and then they will show submission. If everything looks good, if your Mare is behaving normally, if she's having normal estrus cycles, if she's ovulating normally, she has a big follicle, she has edema, her cervix is open, you can breed that Mare. Inseminating is the best option for that Mare, because if she's not reacting to teasing, most likely she's gonna give you a little bit of a battle for the stallion to do natural cover. But if you inseminate Mares like that, you can have a very good success rate.
Great. Well, that's all the questions we have here.
Awesome. Thank you, guys. Thank you very much for joining us, and thank you. I really appreciate it.
And thank you, Dr. Gomez. And we'll join everybody January 30th, I believe, is the next webinar.
Yes.
And yeah, we'll see everybody then, and look out for the link to register for that coming up soon.
Perfect. Thank you.
Thanks, everybody. Good night.
Bye. Good night.